Welcome to the Vital Spirit podcast. I'm Dr. Kelly Livingston, a naturopathic physician and your guide to a new health reality, one that connects body, mind, and spirit. Together, we'll dive deep into the art and science of holistic healing. Through working with hundreds of women through midlife transitions, I've discovered something profound. Most of our physical and emotional challenges are rooted in a maladaptive stress response. And true healing begins when we regulate our nervous system. Each episode will explore complex health topics in simple, empowering ways, uncover the deeper wisdom within each of us, and share practical tools for nervous system regulation to help you awaken your vital force and create lasting wellness. So, if you're ready to reconnect with yourself, your health, and your purpose, let's begin this journey together so you can experience life more fully human and deeply healed. Hi, and welcome to the Vital Spirit podcast. I'm Dr. Kelly Livingston. If you're new here, the show is where we explore healing through a naturopathic lens, mind, body, and spirit, with deep respect for the body's innate intelligence. And if you've been here for the last few episodes, then you know that we just moved through a series on health awakening. Those episodes were about waking up to the fact that your symptoms are not random, waking up to the fact that reductionistic model that you were handed is incomplete, waking up to the reality that healing is not something done to you, but something that you participate in. So now we're transitioning. We are moving from that wake up call to now that you're awake, here's how we live, here's how we integrate. And the first place we go after awakening is not a protocol, it's not a supplement stack, it's definitely not just labs, it's self-knowledge. And in the world of clinical reality, when I'm meeting with patients one-on-one, it's something that we are able to dive in together into. And I hope that today I'm able to give you some of these tools so that you can navigate this transition on your own as well. You cannot sustainably heal a body that you are not living inside of. So today's episode, Know Thyself, Heal Thyself. Physician, know thyself. Actually, it's physician, heal thyself, but I'm going to leave that instead of editing it out. But physician, heal thyself is actually part of our education as naturopathic physicians. And I learned so much through that process. So I want to share some of that with you here today. And a quick reminder, as always, this podcast is educational. It's not medical advice. So use discernment, work with a clinician when needed, especially if you're dealing with trauma, major depression, anxiety, eating disorder histories, or anything that feels destabilizing. There is absolutely no shame in needing support. A lot of what I'll share with you today, you can do on your own, but sometimes we need a guide, and that's okay. It's more than okay. Also, today we're going to talk about patterns and emotional styles, and this can bring aha moments and insight, but it can also bring emotion. So pace yourself. You can pause the episode, you can come back. You're in charge of your nervous system, right? So I want to share something that I wrote many years ago because it's still the spine of what I believe as a clinician. When we are healing, it is often necessary to work through darkness and discomfort on physical, mental, and spiritual levels. It is necessary to know thyself, to heal thyself. That's from a journal entry of mine. It definitely relates back to my education in philosophy as an undergraduate and the fact that the unexamined life is not worth living. It's something that I hold dear to my heart. And I'll add something as a clinician, the unexamined body does not heal. Because healing requires knowledge, and knowledge requires willingness to learn. So this episode is not about personality theory for entertainment. It's not what's your Enneagram as a cute identity label or conversation starter. It's about something deeper and more clinical, that your symptoms are often being fed by your patterns. And in midlife, especially through perimenopause and menopause, the body becomes less tolerant of some of those unhealthy patterns. So I often say that perimenopause is not just a hormonal transition, it's a tolerance transition. The strategies that helped you survive, achieve, and cope in your 20s and 30s stop working in your 40s. And then women come in and they say, I don't feel like myself anymore. My anxiety is worse. I'm exhausted all the time. My gut is reactive. My sleep is broken. My motivation is gone. My resilience is no longer there. My hormones are off. And yes, hormones matter. That's why I have an episode on how to test for them and what they mean. But I'm here to tell you something that I find to be so clinically true. If you don't understand the state of your system and the patterns that created it, you will repeat the same physiology over and over. And you'll call it random. It's not random. It's not just your hormones acting up. And this really matters. So let's talk physiology for a moment and the physiology of perimenopause, because perimenopause is a time of increased variability, right? We talked about how progesterone is dropping first and then estrogen is really erratic. I used that analogy of a toddler controlling the light switch. Hormones are fluctuating, they're moving around, and sleep does become more fragile, especially as progesterone declines and we have less GABA, we have less of that calming inhibitory neurotransmitter to initiate sleep. We also might have blood sugar dysregulation waking us or cortisol rising too soon when our HPA axis and circadian rhythm are off. So sleep is impacted. As I said, our blood sugar tolerance is also changing. So that window of tolerance that we have around how much our blood sugar will swing after a meal is changing. Our histamine sensitivity can increase, which, as you've heard me talk about, can increase feelings of anxiety. And essentially, your stress response system, your HPA axis, can become more reactive. And I see in my office with patients that when your nervous system is chronically activated, your body makes different decisions. It's going to resource things differently. So digestion changes, it looks different. You have different immune signaling, different levels of inflammation, different amounts of thyroid conversion, different glucose regulation, different neurotransmitter stability. So for some people, this looks like depression or anxiety or sleep disturbances or just that feeling of being on edge or dysregulated. Sometimes it feels like a lack of motivation or depression. So what a lot of women will label in this phase of life as my hormones are ruining my life is actually my stress physiology is running my hormone system. And many of these stressors are not just external, they're internal patterns. So some of those internal patterns might be people pleasing, perfectionism, overthinking, control strategies, avoidance strategies, state changing strategies. And in midlife, we can no longer run away from things by utilizing these strategies. We can no longer push through by utilizing these strategies that served us previously. Because your body is really, really smart, right? It's so intelligent and it is asking you to stop abandoning yourself. And here's something that I see almost every day in clinic. Most women are not living in their bodies, they're living in their minds. They're managing symptoms from intellect and they're trying to outthink physiology. And one of the most important clinical truths I offer is this, that the feeling of safety exists in the body, not in the mind. I was talking with my friend who's a yoga teacher and who does a wonderful Thai massage for me regularly. And she always says to me, and she said it the other day, and it just got me thinking that everyone that she touches is so tight. They're so tense. It's so hard for them to relax. And when you escape your emotions, you often leave your body essentially for the safety of your mind. And that makes sense, right? If emotions were not safe in your upbringing, your mind becomes the safe room, basically. But when we're just living in our mind and living intellectually, our body can't digest our food. Our mind's not able to metabolize estrogen, right? Our mind can't regulate our vagus nerve. Our mind can't resolve chronic inflammation. Our mind is our mind, and we need our whole system online and communicating. And when we disconnect from bodily sensation, we lose our data, we lose our feedback system, and symptoms do become confusing when you're just looking at them mapped out on a piece of paper or just in a lab, right? You don't necessarily know what's helping when you start to make changes. You also might not know what's hurting you, what in your daily life are habits that are hurting your physiology. You might not even know what you feel, and you certainly might not know what you need then. And so many women at this phase are just pushing through, and that is not healing, it's survival. So the first step of knowing thyself is not journaling, although I love journaling. It's not archetypes, although you will hear me talk about archetypes all the time. It's not the personality tests. We're going to jump into some of those in some later episodes. But the first step is really, can you feel the state your nervous system is in? Because our nervous system state drives the decisions we make. Our state drives our digestion. Our state drives our hormone rhythm. It drives the healing process. That's why you always hear me talking about how we need to be in a healing state to heal. So if it's safe to do so, you can soften your gaze or close your eyes for a minute. We're going to do a little exercise. You're going to take one slow breath in through your nose and then one longer breath out through your mouth. And now I just want you to notice, is your jaw tight or soft? Are your shoulders up, clenched high up, or relaxed down? Is your breath shallow or deep? Do you feel buzzing, scanning, or restless energy in your body? Do you feel heavy, numb, or shut down? Maybe you feel present, grounded, and connected. There are 3 very simple buckets you can start to think about your nervous system state being in. One is activated. You might be feeling tight, buzzy, urgent scanning. I need to fix. What can I do? I need to move. I need to stand up. Dr. Kelly, I can't sit here. You might feel collapsed, numb, heavy, foggy, withdrawn. I can't do that. Or you might feel regulated, connected, steady, present, coherent. I can choose might be what you feel in that state. And there's no right answer. This is just data. We're just gathering information. We're becoming aware. And the reason this matters is because you can't talk yourself out of physiology. We will talk about mindset, but when you're activated, you need downshifting tools. If you're collapsed, you might need gentle mobilization. And if you're regulated, you can do the deeper work. So step 1 is to name it. You've heard me talk about the framework of notice, name, story, shift in some previous episodes. So right now we're just noticing and naming. We're saying right now I'm activated, or right now I'm collapsed, or right now I'm regulated. Take one more breath in and open your eyes when you're ready. And if doing that felt uncomfortable, that also matters. That is information. This is the kind of data that I'm looking to extract from my one-on-one visits with patients is how do you feel when we do these exercises? Now let's go into patterns. In my work, I see 5 major energy draining patterns again and again, especially in midlife women. The helper, the achiever, the perfectionist, the anxious scanner, and the controller. And I want to be really clear here. These are not flaws. These are safety strategies. They were intelligent adaptations. They have helped you survive. They've helped you belong. They've helped you achieve. They've helped you avoid shame. They've helped you maintain attachments. But they have cost vitality in some ways, because many of these patterns run on sympathetic activation, and they're fueled by adrenaline and cortisol, and they're fueled by urgency. And over time, that drains the system. And you will see this mapped out in labs. So let's walk through those quickly, and you will probably notice yourself in one or even more of these patterns. So let's start with the helper pattern. This pattern often says, if I take care of everyone else, I will be safe. If I'm needed, I will not be abandoned. If I'm good, I will be loved. The helper often has very high empathy, high attunement, high responsibility, but the cost is self-abandonment. And in perimenopause, self-abandonment turns into symptoms because the body does not tolerate neglect forever. And now is the time where your body is really telling you the message. Let's move on to the achiever pattern. This pattern often says, if I do more, I will be enough. If I achieve, I will be safe. If I keep moving, I won't have to feel. The achiever can look incredibly successful, but the cost is that stillness becomes unbearable. It does not feel safe. And when sleep changes in perimenopause, the achiever often panics because they're trying to force rest. Their body is really trying to force them to rest, and it doesn't feel good. Now we have the perfectionist, and this pattern often says, if I do it perfectly, I can prevent pain. If I do it right, I won't be criticized. If I don't make mistakes, I'll be safe and loved. And perfectionism is often a form of control in disguise. Marianne Woodman's work on perfectionism is amazing. Please go check that out if you don't know her work. And in midlife, perfectionism turns into inflammation because it's chronic internal pressure. Then we have the anxious scanner. This pattern is always looking at what's wrong, not because they're broken, but because their nervous systems have learned that vigilance equals safety. The scanner often says, what am I missing here? What if something happens? What if I can't handle it? What's going on over there? And this pattern destroys digestion. It disrupts sleep. It can create heart palpitations and anxiety, IBS, headaches, and histamine responses. And we have the controller. This is a big one. This is one that comes in my office a lot. And the controller, this is often an attempt to create safety without actually feeling safety. So a controller often says, if I can control my environment, I won't have to be afraid. But you really can't control perimenopause. You can't control what's going on around you as you get older. You really can't control life at all. So the phase of perimenopause and menopause transition often becomes the initiation where control collapses, and that collapse can look like anxiety, rage, depression, panic, fatigue. Again, not failure, initiation. And when these patterns run your life, they keep your nervous system in that stress physiology. And stress physiology is a loop. We've talked about the HPA axis, right? And hormones are going to be more volatile, but also depleted as a result. So your gut's more reactive, you're not sleeping as well, your mood is dysregulated, and they're not just psychological patterns. They're endocrine, they're immune, they're metabolic. And this is why knowing ourself through midlife is true medicine. So we can start to remove some of those unhealthy stress patterns. Now, because I'm a naturopathic physician and I'm like a 5-year-old who says, but why, but why, but why? I want to know why we have those patterns, right? Our patterns are often built on emotional styles. So what does emotional style mean? It means, how do you handle emotion when it shows up? And you can just pause for a moment and think about that question. How do you handle emotion when it shows up? Because emotions are not optional. And if they're not processed, they move through the body. They move into the body sometimes, they move into behavior, they create symptoms, and your body doesn't know the difference between a thought and a true danger in the environment. So your nervous system responds to internal threat the same way that it responds to external threat. So let's walk through some of the common emotional styles I see, and maybe you recognize some of these in your own life. You might see some overlap, right, in the patterns that we just went over. So first, avoidance and distraction, staying busy so there's no time to feel. This often comes from environments where feelings were unsafe. I talked last week about a patient who had really been taught that her feelings were not safe, or feelings have been invalidated or inconvenient. So this might look like a woman who has more anxiety in the afternoon, and instead of pausing, she fills every moment with tasks or scrolling on her phone. It's so easy to pick up our phone and avoid, right? With noise, with productivity. And her sleep starts to become more disruptive. Maybe her digestion is slowing down and she has some constipation, and her cycle is becoming more symptomatic. Another style is state changing. So that's using external tools to change how you feel: food, alcohol, sex, shopping, drugs, over exercising, overworking. This often comes from emotions that feel way too big to hold. An example might be a woman who has social anxiety and she goes out with friends after work and she grabs a glass of wine, and then it starts to become a habit where she drinks wine every night to relax, and then a couple more glasses she needs to relax, and her blood sugar becomes unstable. Her hot flashes worsen as she goes through perimenopause, and she thinks, oh, it's just hormones, but it's alcohol plus HPA axis disrupting her sleep architecture and creating vasomotor symptoms. Next, we have overanalysis, so intellectualizing feelings instead of feeling them. So this often comes from environments that really valued intellect over emotion, or where emotion was shamed. So an example might be a woman can explain her trauma perfectly, but she cannot feel anything in her body when I ask what that feels like. She might have chronic gut symptoms, muscle tension, maybe jaw tension, and fatigue. And her system is stuck in a freeze pattern where her body is carrying a lot of the load because she's always just in her head intellectualizing her feelings. Then we have blaming, they made me feel this way people. This often comes from shame about feelings or environments where accountability was unsafe. So this might look like a woman who feels overwhelmed and resentful but cannot locate her own needs. So she's externalized her emotion. Her nervous system stays activated and her inflammation stays elevated, but she doesn't even know how to articulate what she actually needs or wants. She's just kind of mad at everyone around her. And then we have the empath pattern. So taking on others' feelings as your own. So this can come from childhood roles where you just had to read the room to stay safe. You had to know what's going on around you. You had to pick up on very small cues and you got really, really good at it. An example might be a woman who's really exhausted after spending time in a social situation. And she thinks she's an introvert because she's so tired after being with people, but she's actually absorbing and managing the emotional field around her. So her adrenals are constantly working and she cannot rest. And then you have somatic manifesting where emotions express as physical symptoms because they have to go somewhere. So an example might be a woman cannot feel her anger consciously, but she has migraines, TMJ, IBS flares, pelvic pain, and the body is really the messenger of hidden emotions. And here's the reality. If you don't have emotional processing tools, which there's no shame here, so many people come into my office and don't have any emotional processing tools, but then your physiology is going to become the processing system. And this is why I look at perimenopause as a portal, because the body is getting louder and it demands honesty. So I want to introduce a little exercise that I use in my group program From Burnout to Balance, and it's called Situation, Feeling, Response, Regulation Tool. So Situation, Feeling, Response, Regulation Tool. And this is really practical, so pay attention. This will help. And it's one of the most useful tools I teach because it's simple and it builds neuroplasticity. So let's do it together. Think of something that happened this week that caused a reaction. It doesn't have to be dramatic. It could be a text message, a work meeting, a moment with your partner, a moment with your child, a moment alone. Now, name the situation, what happened objectively. You can even write down a short sentence about it or say the sentence to yourself. Name the feeling. What did you feel? If you don't know, start with basic categories or look up the feelings wheel and try to identify the feeling that you had at that moment. Sad, angry, afraid, ashamed, lonely, disappointed, frustrated, overwhelmed. If you want to go deeper later into the feelings wheel, I highly recommend just keeping it on your fridge, especially if you have kids. It's amazing to start to have a vocabulary around our feelings at a young age. And then response. What did you do? Did you distract? Did you overanalyze? How about people please? Did you try to control? Did you shut down? Did you drink? Did you snap? Did you spiral out in your head? No shame here. We're just labeling, we're noticing. And this is pattern recognition. Please have compassion with yourself while you do this. Now, regulation tool. What could support you in that moment next time? Could you put a hand on your chest and slow your breath down? Could you take a longer exhale and activate that parasympathetic nervous system? Could you go walk outside for a few minutes? Could you splash cold water on your face? Could you do some EFT tapping? Could you text a safe person you trust? Name the feeling out loud that you felt. Notice where you could have a boundary, where you could have a pause, right? Next time you can change how you react. And this is truly neuroplasticity, which I usually talk about, like when you go on a hike in the woods and you're hiking on a trail, the more that that trail has been hiked on, then there's going to be a path and you're going to be able to follow it. You can always go off trail and create more trails. And that's kind of like neuroplasticity. So it's the brain's ability to change its structure. And every time you interrupt a pattern, and especially a pattern that maybe you were not awake and aware of, you weaken that old circuit. And every time you choose a new response, a new path on your hike, you strengthen that new circuit. And healing is repetition, not just insight into, oh, I recognize now that that's what I was doing, but next time changing what you do. So write that down now and practice it later if you can. Situation, feeling, response, regulation tool. Situation arises, you have a feeling, you have a typical response. What's a regulation tool you can insert to change your nervous system state and have a healthier response? And this one exercise will change your life if you practice it consistently. And if you have a relationship where you're struggling with communication, I'll get into nonviolent communication in another episode, but even just practicing this exercise when you have to interact with that person you're having communication issues with can be so helpful. In a future episode, I will also walk you through EFT exercises and some other things that you can do in that moment to shift. But I don't have time to do that today. So I just want to make it clear that why this matters in perimenopause is because you're interrupting a stress pattern and you're reducing threat signaling when you do that. So that's going to lower hypothalamic output. It's going to reduce that HPA axis strain, that unhealthy stress response. And over time, that's not only going to stabilize things like sleep, mood, and digestion, but it's also going to impact your sex hormones, which are all downstream from your stress hormones. So take one more breath in and out and just notice, do you even feel 3% more space from understanding your stress pattern a little bit and knowing that there are tools that you can implement to do something about them? And just briefly for a moment, give yourself some grace and compassion and know that you can acknowledge these patterns. You can honor that they've been protecting you. Even if your body goes into urgency and you're trying to control and provide a safe space, you can soften, you can return to your breath, you can choose a new response. I want to mention a quote that I really love by a gentleman named Robert Holden. And he said, "No amount of self-improvement can make up for a lack of self-acceptance." So this is really important in this episode and just in the work I do in general, because many women approach healing like a performance or a perfectionistic endeavor, or really linked to how they look sometimes. And almost like we have to earn it, like it's going to be difficult, right? And that mindset itself is a stressor. Self acceptance is safety, and self acceptance through knowledge of self is the foundation for change. So when you feel safe in your body and mind, healing really can begin. Not just symptom reduction, but deep healing. So part of knowing thyself is noticing, where do I still treat myself as a problem to fix? Where am I still trying to earn my worth through health or how I look? Because that pressure alone can keep the HPA axis elevated and the gut reactive and your nervous system bracing and on overload. So, yes, we do labs. Yes, I use protocols and herbs and food as medicine. But if you don't cultivate, number one, self-knowledge, and then number two, self-acceptance, then you will turn healing into another achievement project, especially if you're more prone to those achievement patterns, right? Or perfectionistic patterns. And your body's going to resist that. Now, I want to give you something else really practical, because once you start seeing your patterns, a lot of women will ask, okay, but how do I actually get to know myself deeper? And I want to be clear that this is not about collecting labels. It's definitely not about building a new identity, but it's about using mirrors that can help you notice what you maybe couldn't see before. So I'm often doing this and guiding patients in this process. I'm doing this with patients in a safe container, but you definitely can start to do some of this on your own if you feel up to it. And I like to break these mirrors into three categories. We have external mirrors, we have internal mirrors, and we have guided mirrors, because knowing yourself is not just one thing. It's a practice, and the goal is not to become a different person. The goal is to become conscious about your patterns and about some of your archetypal patterns that not only are your own, but maybe relate to the collective unconscious as well. So external mirrors, these are essentially the show me my patterns mirrors. So these are tools that reflect your tendencies back to you, to give you language around them, to give you a starting point, to help you start to name those default strategies for love and safety that you've been enacting your whole life and maybe aren't aware of. A few that can be incredibly useful that maybe you've heard of before: Enneagram. This is probably one of the most clinically relevant personality systems I've found for midlife women. It doesn't just describe behavior, but it describes motivation. So it's going to ask, what is the fear underneath this behavior? What is the core strategy? What is the stress response? And this matters physiologically because your stress pattern is not abstract. It has endocrine and nervous system consequences. It's actually going to manifest in physical reality. So say you're a type 2 pattern, that helper over giver pattern, that's a sympathetic strategy. If you're a type 3 pattern, that achiever driver pattern, that's often adrenaline based output. If you're a type 1, that perfectionist pattern, that's chronic internal pressure. So Enneagram can help you see the why beneath some of your behavior. I also like Myers-Briggs. This can be really helpful for understanding temperament and how you process information and energy. It's not a trauma map or a nervous system map, but it can give you language for things like, do you recharge alone or with people? Do you prefer structure or flexibility? Are you sensing based or intuitive based? These things matter for regulation and capacity and for knowing what patterns you want to feed and what patterns you want to avoid. You also have the big five personality patterns. This approach is more research based and can be helpful if you like a more psychological lens, especially if you notice traits like high neuroticism or low conscientiousness or high openness. These traits can predict stress reactivity and coping styles. Again, they're not destiny, they're data. I love my Carolyn Mace archetypes. Archetypes are so powerful because they speak to the symbolic layer of the psyche and they help you see, what role am I living from? Where's my power leaking? Where am I giving away my authority? And when you can name an archetype, you can stop unconsciously acting it out. And that's a really deep form of healing. So where am I in a pattern, such as the caregiver, the wounded healer, the rescuer, the judge? I've talked about her archetypes before. They map really well with Jungian personality patterns as well. And then, of course, you have tarot, I Ching, human design. And I want to be careful here because no, these might not be medical tools. They're not diagnostic tools, but they're really meaningful mirrors for self-reflection for many patients. And if you can use them with maturity, they can help you access a part of the psyche that the intellect cannot always reach. Symbols speak to our psyche. And sometimes the mind is too defended, right? Sometimes the mind is too busy, and a symbol can bypass that. But here's the rule: use these as prompts for inquiry, not as authority. Definitely work with someone who's more familiar with those tools if you're drawn to do that. They're not prediction tools necessarily, but again, they're pattern recognition. And they might help you see truths about yourself that you're not yet seeing. They might help you to answer the question, what part of me is asking to be acknowledged? What patterns keep repeating? You can tap into different energetic frequencies through these tools and absolutely learn things that you might not have had access to on your own. And certainly they might help answer the question of what is trying to come into consciousness here. Now, some internal mirrors we're going to talk about is essentially where the healing actually happens. And some internal mirrors I recommend first would be journaling. So journaling helps you to slow down enough to hear yourself. And if you start journaling, you can then even look at that journal and look for patterns in the journal. And that's really going to help you name the internal landscape. And you can start to ask yourself, what pattern did I notice today in my daily life, in my behavior, in my feelings? What emotion did I avoid today? What did my body try to tell me today? You can even just journal some of your physical symptoms and start on the physical plane. If you want to go deeper, you can use the exact tool we used earlier, situation, feeling, response, regulation tool. And that is journaling as nervous system medicine. You also have time alone. If you never spend time alone, you will not know your own signal because you will always be in someone else's field. Even 10 minutes alone, no phone, no task, just what do I notice? Tapping in to self. Some patients can't do that immediately. And obviously, if you have a history of trauma and that doesn't feel safe, don't do that alone. Sometimes a nice bridge is spending time in nature. So mindful time in nature can be an internal mirror. Nature is one of the fastest ways to downshift your stress physiology. And when you downshift, you can actually hear yourself. You can feel your body again. And that's why nature is not just a luxury in midlife. It's a regulation tool. It's a hormone tool. It's important for our immune system. Getting out in nature is one of the best parasympathetic snacks you can do every day. And then conscious movement. So movement to return to sensation, movement to link body and breath. Yes, of course, yoga, walking, stretching, shaking, anything that helps you inhabit yourself. Because yes, the body does keep the score, and that movement helps the body to speak to you. And I would also put prayer, meditation, mindfulness practices, and just sitting still in this category as well. So if you want to know your inner voice versus your inner critic, which we could have a whole episode on, you need to get quiet, even 2 minutes. And Stillness is where we learn the most about ourselves, both body and mind. And in my opinion, it's where we can hear our soul. And last, we have guided mirrors. So if you feel like you need support to go into this work safely, some guided mirrors might be helpful. And some patterns really are just too deep to unwind alone, not because you can't do it, but because your system might have learned that that doesn't feel safe. And guided mirrors would be things like therapy. So therapy is not one size fits all. The right therapy can change your life. The wrong fit can feel like nothing's happening or like you're being managed intellectually, sometimes patients will say. So if you want deeper pattern change, look for approaches that do include the body and the nervous system. So this might be IFS, internal family systems. It might be EMDR. Hakomi is one of my favorites. Somatic experiencing, family constellations. Just start to look into some of those and see what resonates with you. They can help you access stored emotional material and update the nervous system, because insight alone is not going to just change physiology. We need embodied integration. And then mentors, elders, safe practitioners. Healing does often require a safe container. So you do want support that can hold the darkness that might come to light. So yes, this work is courageous, but it should also be resourced, and ask for help, right? We all need help in this process. And if that sounds overwhelming, let me give you a little bit of a guide so you don't feel like you're going to get lost in this work. Here's a simple framework. Pick one external mirror, pick one internal practice, and pick one guided support if you need it. Not 10, not try this, try that, look into this, look into that, because that's another achiever pattern, right? So here's an example. Know Thyself starter set. An external mirror might be Enneagram. An internal mirror might be that situation, feeling, response journaling 3 times a week. And guided support might be a somatic practitioner if trauma layers are present. Or external mirror might be Carolyn Meese archetypes. You can pick up one of her books, even Sacred Contracts is my favorite. An internal mirror might be nature time, let's say 10 minutes a day and 2 minutes of journaling, and some guided support might be a group program or a therapist. So the bottom line is that these tools alone are not healing you, they're revealing you. And your willingness to see yourself is what heals. I always say that patients come to be known, but first they have to do the work to know themselves so that they can reveal themselves to me as a trusted practitioner. And a lot of times we're doing this together. And in perimenopause, this is really clinical because what you don't acknowledge in the psyche becomes physiology. So, yes, I'm going to run labs. Yes, we're going to look at the physical. Yes, we're going to talk about mind and emotions, right? But when you are not able to process these deeper aspects, what you keep unconscious becomes hormone patterns in labs. It becomes inflammation. It becomes burnout. So we use these mirrors to become whole. So as I wind down, I'll leave you with the thought of choose one pattern you heard today that resonated: helper, achiever, perfectionist, controller. Use the situation, feeling, response regulation tool just once this week, just once when you're exhibiting one of those patterns. And you can do one round of breath work to pause and give yourself space instead of responding. So that can just be 2 to 3 minutes of long, slow exhales. Exhales longer than your inhales. So inhale for 4, exhale for 6. If you want to go a little more advanced, you can do some EFT tapping. I'll try to do an episode on that soon. And just ask yourself, what am I avoiding feeling? That's it. Small shifts repeated often. And one more important thing, sometimes when you turn the light on, as we are doing through these health awakening journeys, you see things. You might see grief. You might see anger. You might see trauma layers. You will see patterns that formed for a reason. If I could give you a hug, I would right now, because I know sometimes that feels like a lot. And this is of the utmost importance. You need to feel safe in the set and setting where this healing occurs. So some of you can do this work with journaling and breath and small tools, and some of you will need a guide, a therapist, a somatic practitioner, a trauma-informed clinician, and this is not weakness. Knowing that is wisdom. So let's close with a quick grounding exercise. Place one hand on your chest and one hand on your belly. And take a slow inhale and an even longer exhale. Slow inhale, even longer exhale. Now name one pattern you saw today, just one. I'll remind you: helper, achiever, perfectionist, avoider, controller, overanalyzer, empath, state changer. And now ask, what is this pattern trying to protect me from? And where does it live in my body? Jaws, throat, chest, belly, pelvis. Now take one more deep breath in and a really long, slow exhale out, even like you're blowing through a straw. And remember, you are not broken, you adapted. And now that you see it, you can choose differently. Because healing is not becoming someone else, it's becoming conscious. Because the body heals when the lights come on. If this episode resonated, please share it with someone who is ready for this level of work. And if you want a simple place to begin with nervous system regulation, you can download my free vagal tone guide. It's linked on my website and in the show notes. Next week, we move into something foundational in naturopathic medicine, and that is the healing power of nature. What it is, how to assess it, how to cultivate it, and how to remove the obstacles that block it. Because awakening is one thing, but healing is living it. I'll see you next week.